between Medicare medical costs, long-term care costs, we're talking about needing maybe $500,000 per person. That between a couple is $1 million. A lot of people say, hey, if you want to retire on $1 million and only take out a small amount each year to live on so you don't run out of money, you're going to live off of 40 grand a year. Well, you might just need all that money just for medical expenses rather than just living expenses.
Hey guys, thanks again for tuning into another exciting edition of Talking Retirement. I am your host, Ken Connolly, and we have an amazing episode for you today. We have the big boss of NJ Life and Health himself here, John O'Hara, and we're going to be talking about 5 things you may not know about Medicare when it comes to cost specifically, but sometimes some other things as well. So thanks so much for coming on today, John.
Thanks for having me here today, Ken. Very excited to go through these 5 things that people don't really know about Medicare.
Yeah, so let's dive in real quick. I know the first thing, and something that's super exciting that we get to talk about, and we're a bit of a spoiler here because it's not the news people want to hear, but the first thing people don't understand is Medicare is not free. I know we pay into it our whole lives, but it is not free once you get there.
That is a great way to start. And yes, it is not obvious to people that Medicare is not free. And there are some costs that come with Medicare that for some people are unexpected. And I'd say one of the biggest complaints we hear from our clients are that their financial advisor, if they have one, or retirement advisor, didn't really make it clear to them how much Medicare could really cost if you want some sort of comprehensive coverage. So what we're going to go through first is, what does Medicare cost and what are the variables that might affect that for different people? And to keep it as simple as possible, Medicare has a couple different pieces depending on which way you go about setting it up. But for that most comprehensive type of coverage that exists, if you want the best coverage that's out there for Medicare, your picture kind of looks like this. You've got original Medicare on one hand, and that actually has a monthly premium through the government of $164.90 a month as of now in 2023. That number can fluctuate year over year. But to keep it very simple, Medicare A and B has one cost associated with is the Part B premium of $164.90 a month. And that's the base premium for people making under a certain income threshold. If for any reason you make above these income thresholds that are set by the government, they might actually charge you more for that. But that's the first piece we want to focus on, is that Medicare has a cost that you pay directly to the government to have it, right? Now, in addition to that, people have other products that they add on to this to make that Medicare more comprehensive. On its own, if we're keeping things super rudimentary, Medicare only covers 80% of all of your healthcare benefits, and it has a lot of out-of-pocket costs, deductibles and excess charges and all sorts of variables to supplement that and make this comprehensive Medicare package where instead of being covered at 80% with some out-of-pockets, you're covered at 100% instead. That involves an extra premium as well. And depending on the state, that can vary, but if we give it an average, that might be an extra, say, $130 to $150 a month. So when we put the whole medical picture together, if we want to be covered at 100% with our medical coverage, you might be right around $300 a month to have Medicare. And that doesn't include prescription costs that come in addition to that. So if we're keeping things very simple, let's just say on the health side, we've got around $300 a month that you might pay for Medicare. And that's if your income is below those thresholds that the government sets. If your income is a little bit higher, that number could be increased.
And it's interesting you bring that up, because a thing a lot of people don't realize is it's not your income now they look at. It's actually your income 2 years prior. So a lot of people, before they go on Medicare when they turn 65, or maybe even due to disability, but most people could be in their peak working years. You know, they're 62, 63, they're at the end of their career, they're doing pretty well. All of a sudden they get hit with this bill for Medicare from the government, not even from us, that is $200, $300, $400, or $500 a month per person in their family. And it's just a ridiculous cost that can really make it hard to budget and in some cases make it unaffordable or not the best option.
Correct. And that income-related adjustment, they call it, that they bring on if you are making above a certain income threshold 2 years prior, sometimes there are ways to negate that. You know, if you've just stopped work, or if you had a loss of a spouse, or some other major life-changing event, Social Security will let you file to try to remove that income-related adjustment. But for a lot of people who receive a pension or they start drawing on their 401k as they retire, sometimes that's not possible. So as we kind of circle back to that number that we came up with, which at a base Medicare could be around $300 a month in total, increased based on income. But what we got to think about is, what does that look like over a lifetime for a single individual? Because as we mentioned, a lot of people start to have these complaints that their financial advisor, retirement advisor never brought this number to their attention when planning, and it actually makes a huge difference, because if we're looking at $300 a month, it's about $3,500 a year. And as you get older, some of those costs slightly tick up. So we're looking at anywhere from $300 a month, or $3,500, $3,600 a year, up to almost $500 a month in the later years, maybe towards the 80s, which could be $6,000 a year per person. So if we're looking at an average of $4,000 to $6,000 a year per person, look at that over a 20, 25, or 30-year lifespan from the time you turn 65. That's an astronomical number, right? If we're looking at maybe, I'd say $40,000, $50,000 over 10 years, if you live for 20 or 30 years, you could be looking at $120,000 to $150,000 over your lifetime that you're going to spend on Medicare premiums, and that's for a single individual. Imagine you were a couple. There's two of you. Maybe if it's $150,000 over a lifetime for one of you, now it's $150,000 a lifetime for the other, member of the family. That could be $300,000 altogether. That seems like a pretty important number to tie into your financial plan when you think about, this is what I've got to live off of for the next 30 years. Maybe that $150,000 to $300,000 should be in there somewhere. Surprisingly, people complain, I never heard anything about this.
Yeah, it's so funny to me that a retirement advisor is probably like, oh, we're going to make sure you can see Rome finally. We're going to make sure you can see your kids. But the most important thing is healthcare. This is the part of your life that statistically you're just going to need more healthcare. And if you're not able to pay those bills, it's going to wreck everything incredibly. But I think that can kind of segue into our next point, that even though the premiums can be high and it can be a burden on some people, if you're on original Medicare with a Medicare supplement like a Plan G or something like that, your out-of-pocket costs are much more manageable and actually very predictable, so it can make it easy for you to budget for things like surgeries, like things like that.
Correct. When you do it right, as we kind of built this picture of this $300 a month, that's basically, if we're keeping it very simple, that's all that you're going to put out. There is no ancillary cost for surgeries or hospital stays. You don't have to budget for that variability. But unfortunately, what does happen is you got to budget for the variability of the drugs, which we'll get into in a moment, how that's actually going to be fixed, hopefully in a couple years, so there isn't as much variability there. But what I think is important is that we go into the one next piece that people also don't tie into this cost, which is long-term care. People have this huge misunderstanding that Medicare is going to pay for long-term care, which is defined as in-home health care or nursing home care when somebody hits the point where they can't eat, feed themselves, bathe themselves, transfer from the bedroom to the toilet to the shower. When those things become too tough for an individual, they need some type of ancillary care. Somebody to watch them, make sure they don't fall over in the shower, somebody to help them eat and use the bathroom. That is actually not covered by Medicare. That's considered long-term care, which is totally separate. If we're talking about all this money spent on Medicare, and then there's no money, even discussed for that long-term care, that's another huge factor that people don't take into consideration that I think is important for them to know about.
And it's crazy. We have another video coming out on this, so I'm definitely excited to drop some facts for you guys. But a study recently came out, 56% of baby boomers thought that Medicare paid for long-term care. Yeah. So right off the bat, more than half of people entering their older years now think that Medicare is going to front the bill, and the Department of Health and Human Services thinks that the average baby boomer is going to average about $138,000 each in long-term care costs. Now, that could be a nursing home, that could be a home health aide, all those different things. So you're basically on the hook for close to $150,000, and you think the government's going to pay it, and they're not. So we're looking at a lifetime cost with Medicare probably in the six-figure range as well. And if you add some long-term care onto that as well, that's doubling that cost. And far too many people think that Medicare is going to pick all this stuff up, but it doesn't. And to kind of even deepen that, 70% of people say they don't want to stay in a nursing home. And obviously there's different types of long-term care and everything like that, but 70% of people are going to need long-term care. So the same amount of people who don't want to go to a nursing home are the same people that are probably going to need one at some point. And that cost can be anywhere from $5,000 to $10,000 to $15,000 a month, depending on where you live. It can get very, very high and super burdensome.
Yeah, and here in New Jersey, for an example, it's around $9,000 a month to have a live-in home health aide. Even to just have somebody there 8 hours a day is about the same cost. $9,000 a month to have someone in the house taking care of you for what Medicare doesn't cover. A nursing home is even more expensive, and that's the least preferred method for people. So most people won't want to go to a nursing home, even though most people will need that type of care. The majority of people have started to steer towards staying home and having an in-home health aide there, but that cost is just as burdensome. At $9,000 a month, Doing that over a year is around 100 grand, and if you need it for a year and a half on average, that could be very, very expensive. Between Medicare, medical costs, long-term care costs, we're talking about needing maybe $500,000 per person. That between a couple is $1 million. A lot of people say, hey, if you want to retire on $1 million and only take out a small amount each year to live on so you don't run out of money, you're going to live off of 40 grand a year. Well, you might just need all that money just for medical expenses rather than just living expenses. So definitely a huge topic of conversation that people should bring up earlier in their journey through Medicare is, what am I going to do about this long-term care? Because as we know, there are solutions, things like long-term care insurance, where you can pay a relative premium and then they will pay you back a monthly fee to handle all of this in-home health care, which is a great option. But as you are aware of, if you don't have the money for that, then it comes down to this Medicaid spend down scenario, which can definitely take a toll on any assets left over to the family.
Yeah, and just as a quick brief, what a Medicaid spend down is, if you need a nursing home and you can't afford $5,000, $10,000, $15,000 a year, what happens is the state will basically burn through all your assets and income until you qualify for Medicaid, which is, virtually no money in your bank account, no money coming to you. And at that point, you can take Medicaid and everything's covered, but if it's 50, 100, whatever it is, you're going to burn through potentially hundreds of thousands of dollars worth of money before that happens. So it's really unfortunate that people don't see that coming.
It takes away all the inheritance from your kids. A lot of people think, I'm going to leave this to my kids. I'm going to leave them the house that I paid off. And unfortunately, during this Medicaid spend down to get long-term care that Medicare doesn't cover, you spend away all those assets you were going to leave to your kids. And they do let you keep the house while you're still alive, but Medicaid is not really free insurance. It's kind of a loan from the government, where if they pay for a year's worth of nursing home care at a value of $150,000, when you pass away, they're going to send you a bill or put a lien against your estate for that $150,000 that they spent. So a lot of people say, oh, in the Medicaid spend down, I can get rid of all the money I have, but I can still hold on to this house and pass it to my kids, only for the kids to find out, well, the government put out $150,000 on your behalf. Now they want that money back so they can use it for somebody else, which is not a terrible thing. But if you don't protect that asset way earlier before you face this scenario, there's basically a 5-year window you want to avoid. If you don't protect that house, the government comes back and says, hey, we're putting a lien against your estate, which includes that house that you're trying to leave to your kids. So the kids kind of suffer the worst if they're planning on, in any sense, getting the house that their parents want to send down their way or getting any assets. There's nothing left for the kids once you get done this Medicaid spend down and having Medicaid pay for you to be in a nursing home. You have to plan preventatively long before this time ever comes.
Yeah, it's crazy because most people think I'm going to leave XYZ amount of money to my kids, and on top of that, I'm never going to need a nursing home. And because
both are not true.
Exactly. And it's sad, like, we shouldn't laugh because we get caught in the crossfire of this, but it's like just, a stubbornness and a failure to have these tough conversations now can really hurt you down the line when you least expect it. And we actually had this happen to a friend of ours. They didn't have these conversations. Their mom out of nowhere needed long-term care and basically couldn't take care of herself. And at that point she said, okay, what kind of insurance can I get? What kind of government help is there? And unfortunately, it's nothing. There's nothing you can get at that point.
Correct. And most kids find themselves in this transition period taking care of their parents themselves. You're the one that needs to help your parents transfer from one place to another, to eat, to bathe, to dress, and to do that full time, which is almost 24 hours a day. You've got to leave your job. You can't be working full time and taking care of your parents full time. If you have your own kids, you can't be taking care of your own kids. A lot of people don't realize, and I think we, on the new video we're doing, have a couple pieces coming out on this, how many people or how many kids are providing unpaid care to their parents at the sacrifice of their own career and their own family, which we will do for our parents, but a little bit of planning ahead helps you avoid such a rough situation in which some people can't afford to leave their jobs to take care of their parents full time, and it puts you in a really tough and hard to live with situation.
Yeah, it's interesting because I actually have a lot of clients, a lot of what we do is turning 65 Medicare stuff, and I talk to tons of people in their mid-60s who say, okay, this is the time I'm taking care of my parents, and they usually leave work, and at that point you might need every dollar you can get, but they say, I literally can't afford anything else. I need to work at this point, and I need to take care of my parents.
Most people we meet have the same statement, which is, I'm not going to a nursing home. When I get to that point, push me off a cliff. And it doesn't happen to be like that. You end up hitting this point in your life where you want to see your grandchildren get born. You want to see maybe your grandkids graduate high school or get married themselves. And you start to find more and more things to live for that in a younger age you say, I don't want to live that long, just push me off a cliff. But when you get older, you say, no, I do want to still be here, but you hadn't planned for it. So our biggest advice is, if you haven't planned for it yet, start planning for it now. There's no time that's too early. And I think that lets us, wrap up that piece. We'll summarize where we've come to so far and then move on to the next, which is that, one, Medicare is a lot more expensive for people than they come to realize or come to plan for, right? A comprehensive Medicare policy might be $300 a month or more based on income per person. That could span around $150,000 per person in a lifetime. And then you have to add on that cost of long-term care, which people don't realize Medicare doesn't cover whatsoever. So we've got the high cost of Medicare in itself. We've got, long-term care insurance, which adds another high cost. And we will take a pause and notate, yes, there are other types of Medicare policies that don't involve an extra premium and may be a bit cheaper, but then they have a highly variable cost because you're paying as you go. Your out-of-pocket max may be $8,000 to $10,000, which leaves you a lot of, could I pay nothing this year and $10,000 next year? Yes, even averaging that, we'll probably find around the same sort of average price put out depending on the state that you live in, all right? That brings us to our third piece, which is, yes, there is a huge variability in drug costs, right? We've got our variability in what Medicare costs, what long-term care costs, now drug costs, right? Different people's prescriptions could be wildly different in how much they cost, but one awesome solution coming our way, ever since they passed the Inflation Reduction Act, I won't go into too many details, but there's the simple fact, as of 2025, they're putting a $2,000 max out of pocket to the client on all drug plans through Medicare. So whether it's an Advantage plan or a drug plan, you can't spend more than $2,000 out of pocket on covered medications. That doesn't include non-covered stuff, but that removes so much variability, because I know that you've seen as well as I, you enter somebody's drugs into Medicare.gov and it says $10,000 a year. That's really scary for somebody. To cap that at $2,000, that's a huge advantage.
Yeah, it's amazing. And, it obviously sounds kind of scary, but we have to let a lot of people know, most people pay $10 to $20 a month for prescriptions.
Yeah, and everything's free.
Yeah, exactly. If you're on high blood pressure medications, if you're on cholesterol medications, if you're on most antidepressants and anti-anxieties, these drugs that have been generic forever, the cost is almost negligible.
Sometimes nothing.
Exactly. And it's fantastic that that's the case, but what people really get hit with are these brand name medications. You see those
diabetic drugs.
Diabetic drugs, exactly. You see these commercials where they're like chrysanthemum, and it's people running through a forest and they're like reading off all these side effects. Those drugs can be hundreds, if not thousands of dollars a year, and it can be super invasive to people because they just get hit with it. They're spending their times taking a couple statins, paying $10 a month, and all of a sudden it's like, boom, an extra $2,000 a year, and you can't budget it because you don't expect it to happen to you or anything like that.
And we live in such an advanced day and age where these medications could save somebody's life or make their life easier to live. It's a hard choice for the patient that says, okay, I could spend $2,000 on this medication a year and live an easier, happier, better life, or I can't afford that. Now I have to suffer with the health issue that caused me to take that drug in the first place. It's definitely it's always been tough looking at the medications for clients and seeing how much some of these drugs cost. But now with that $2,000 out-of-pocket max coming into play in 2025, $2,000 it's not a lot, but it's surely not a little amount of money. That's a lot of money on a fixed income for $2,000, but at least it stops there. So when we talk about budgeting over a lifetime, at least the worst it could be is $2,000 a year over your lifetime. Right?
Exactly. It's like best case, you pay $100 a year or something close to it. Worst case, it's $2,000, at least it's capped. Something interesting is we're really hopeful this happens. As of us shooting this video, which is July 2023 actually, multiple pharmaceutical companies and the pharmaceutical lobby have sued the federal government in an effort to stop this from getting passed. We obviously hope they all kick rocks and it doesn't go through or anything like that. But our hope is it'll be about a year and a half before this goes into play. Hopefully all the legality will play out by then. This could just be a ploy to stall the bill from passing for an extended amount of time, but our hope is that this passes through and seniors will finally see some relief. And even though it's only 2 or 3 drugs, I believe another part of this plan was that the federal government can start negotiating drug prices. So even though it's just a couple and we're just dipping our toes in the water, that could be a huge step forward for a lot of seniors and older Americans.
Yeah, there are plenty of people who are under 65 on employer insurance or individual marketplace insurance. They come in and say, well, I'm only paying $5 for that diabetes drug, and we have to be the ones to tell them, well, there's a huge deductible up front. You're paying $50 instead of $5, and then you're going to hit this thing called the donut hole and pay $250. Paying $250 a month versus $5 is a huge transition because those private insurers can negotiate drug costs, Medicare cannot. Now you see this huge discrepancy in price that people, they don't expect because they say, well, it's been paying $5 forever. That can't change that much. Yes, it can.
Yeah.
So let's move on to our next piece. We've got the first three: Medicare costs, long-term care costs, drug costs. Here's something that moves away from cost, but definitely brings on something that people are kind of unaware of. When we talk about Medicare supplements or any type of Medicare plan, Advantage supplements, et cetera, people have this ill-conceived notion that you can just switch whatever you want every single year, right? We've got an annual enrollment period that happens in the fall, October 15th to December 7th. The commercials come on TV and people think, well, now's the time I can switch my plan, not understanding that there are two different types of Medicare plans, supplementals and Advantage. One is a comprehensive, pay up front, you're covered in full, whereas the other is a pay-as-you-go style plan. And to switch between the two of those, depending on the direction you're going, there will be health questions that might prevent you from changing. A lot of people think, oh, well, Obamacare, the marketplace says there's no pre-existing conditions. You can't ask me about pre-existing conditions, so I can join or switch whenever I want. That's not Medicare. Medicare supplement plans, which are those fully comprehensive plans, they can take into account pre-existing conditions and they can ask you health questions to prevent you from joining in if you don't do so when you're new to Medicare.
Exactly. And I think something we got to point out is the whole reason we got rid of pre-existing conditions, for Obamacare and the Affordable Care Act was the pre-existing condition threshold was incredibly high. In some cases, it was like, do you have tinnitus? Which does not affect you in any capacity. The health questions in these tend to be more, have you had a heart attack in the past 2 years? Have you had cancer in the past 2 years? Have you had heart failure? Or do you have severe diabetes? So it's not like you have slightly high cholesterol or something like that. Like a lot of people can pass, but what a lot of people don't realize is they might say, oh, I'll take this Medicare Advantage plan while I'm young and healthy, and then I'll switch later. We always joke, you're not going to pull a fast one on the insurance companies. They've planned out every single step of this to make sure they are maximizing, and they want you to pay into it the whole time. And in order for them to, keep their profit margins healthy and to stay in business and everything like that, they're going to make sure they're not taking on someone who's going to rack up 6 figures worth of medical bills in a year. If you're going to do that, they're going to make sure that you have to do it the entire time. But you can actually, regardless of your health, when you first turn 65, get into any Medicare plan, which is a nice thing.
Correct. That's the confusion for people is that when you're brand new to Medicare, like you mentioned, you can take any plan with no health questions that you have the option to take. But when you are not new to Medicare, that's when transitioning from one plan to the other can involve health questions. Now, this only exists in transferring between Medicare supplements or to go from an Advantage back to a Medicare supplement. There is no health questionnaire to go from a supplement over to the Advantage. To go from the comprehensive plan to the pay-as-you-go plan, well, there's no health questions because you're paying for everything you do along the way, so they don't really care how unhealthy you are. You're going to pay for everything you do. It's the supplement where they're paying for everything no matter what. That's when they need to take your health into consideration. But I'd say in 90% of states, this is the case, right? 90% of states, if you're not new to Medicare, you're going to have to answer health questions to go into a supplement or to change the supplement. But in some states, places like I think it's New York or Connecticut or maybe California, there are some states in which there are no health questions for Medicare supplements ever. You can always join into a Medicare supplement despite your health, but the cost is astronomically higher. For example, a Medicare supplement here in New Jersey that you can join no health questions up front and answer health questions down the road if you need to join later, it might be $150 a month. In New York, the same plan, which there's no health questions, might be $450 a month. That's a huge differential. It says, sure, you can join whenever you want, but you're going to pay 3 times the price to do it. And that's how they, again, protect themselves. You're not going to pull a fast one on the insurance company. If they're going to let you in without health questions, well, they're going to charge you a lot more to do it.
Yeah, exactly. They're like, oh, cool, you've been chilling with this Medicare Advantage plan for 10 years and now you got a heart surgery coming up. All right, give us all the money, man.
We'll take it, but you can pay us extra to do that.
Exactly. So it's almost like a double-edged sword where you say, oh, I can always get a plan regardless. It's like, yeah, but is it affordable for you? Which is a tough thing for people to get into.
Correct.
So
the more affordable the plan, the harder the health questions if you didn't join it right away.
Exactly.
That's an easy thing to think about. All right, so that, we'll summarize again. We've got Medicare costs, long-term care costs, drug costs, health questions with Medicare supplements. Now let's move on to one of our, final pieces, which are a little bit of a touch on Medicare Advantage plans, things that people don't realize about them. And I think the biggest kind of, wrong notion is that people think with a Medicare Advantage plan, you can do whatever you want. But it's very clear on Medicare.gov and in some of the summary of benefits that almost every service within a Medicare Advantage plan that's not your basic doctor visit or ER visit requires something called prior authorization, which means the company has to approve whatever you want to do. Whatever the doctor is recommending for you, the company has to agree with that recommendation. Now that off the bat can be scary. If the doctor says, well, I think you've got cancer, let's go ahead and get an immediate CT scan, the company could disagree with that and say, no, we don't think you have cancer. We don't think you need a CT scan. Let's start with something cheaper, and we'll work our way up to that. Now, working your way up to something like that could take precious time off of your life if you are suffering with a serious ailment. Now, this is not, I'd say, this is not the majority of cases that this happens, but it does happen. And a multitude of articles and studies by the Department of Human Health Services have come out showing they do deny a lot of claims or require prior authorizations in situations where Medicare itself would have never done that. So a big thing about this Medicare Advantage side is that, yes, it's less expensive. People always say it's free, why not take it? Well, we already know if you don't like it, you got to answer health questions to go back in most cases. But the problem is that they control what you're doing and when you're doing it. That can be really serious when you have a big health ailment.
Exactly, and I think two things to pick up off that is whenever we give people this disclaimer, like we obviously have lots of clients that have Medicare Advantage plans and we do everything we can to make sure that it's the best one for them, we always say, hey, just so you know, there could be issues, services could get denied. And they always come back with well, my neighbor's uncle's cousin has one of these plans and they got
fine.
They had a $50,000 heart surgery and it was covered at 100%. It's like, absolutely. I have family members who've had major surgeries on Medicare Advantage plans and it was fine. But when you do the volume that we do, we see that,
15%, 20%?
5 to 10%, whatever it may be, that they do get denied. And it's heartbreaking because people are sitting there trying to get a dialysis machine or trying to get a surgery or trying to get whatever it may be, and they simply can't. And it's heartbreaking to watch people not be able to get the care that they want just because a health insurance company wants to make a couple extra bucks. And it's pretty crazy. And then an analogy I thought of the other day that I thought you might think is funny is these Medicare Advantage plans are like certain airline companies that I won't name because I don't want to get sued or anything. But we all know the ones that are super cheap when you check them out on Expedia or Google Flights. And then when you get there, they go, oh, but the bag's $100. Oh, yeah. But your carry-on bag's $50. Oh, but your seat is $50. So you think you're saving all this money, but maybe it would have just been better to fly the company that was $100 extra at checkout, but there's no actual cost after that or anything.
That analogy works so perfectly because those airline companies that nickel and dime you for everything along the way, they also say, and there's a 50% chance you don't even take off today.
Exactly.
Don't even fly.
It's like...
The same thing can happen with an Advantage plan where they say, great, you're going to be nickel and dime for everything along the way, but there's a chance that you don't even get to do it in the first place. That is, although we laugh about it because the analogy is amazing, it's really dangerous for people. I've seen people denied portable oxygen machines that couldn't make it to the doctor with the oxygen tank. I've seen people told that, hey, the only place that can do a kidney transplant for you in the next year is this hospital, but they're not in network and you can't go there, so no kidney transplant for you, right? We've seen people denied CT scans when they have cancer and wait months to get one, only to pass away from said cancer. Denied epidurals, told they need months of physical therapy before knee replacements, joint replacements, kicked out of rehab or therapy post-hospital. We have so much volume, as you've mentioned, that for every Susie or Janie down the street that says this plan is awesome, we get to see the Bobs, the Robs, the Sallys, that say, well, this actually almost ruined my life, if not caused my significant other to pass away because they were denied this type of care. That is so serious. And for us, what we always like to help people understand is that you're kind of rolling the dice in every scenario. If you roll the dice and it doesn't land on the number you're looking for, you don't get the care, and maybe that affects the rest of your life. There's a 1 out of 5 chance you get the wrong number, maybe a 4 out of 5 chance you get the right number. For me, I would never take the 1 out of 5 chance that it goes wrong if the difference of avoiding that is maybe paying $100 for a Medicare supplement, if I can afford or budget to do that. Some people we find, yes, they're in a really financial hardship situation. They've got to play that game of chess. They've got to take the risk and hope that everything goes well. And the companies know this because they provide a lot of incentives to stay healthy. They say, hey, here's a gym membership, here's nursing care, like a 24-hour nurse line.
Here's like fitness videos and nutrition courses.
Everything we can give you to stay healthy so that you don't end up in this position where you can't afford the care that you need. Just stay healthy and don't get sick. That's
Exactly.
the motto. Stay healthy, don't get sick.
Yeah.
HMO, which is the most popular original Medicare Advantage plan, right? A HMO plan stands for Health Maintenance Organization. We're here to help you maintain your health, not treat you when you get sick. That's going to cost you a little bit extra, right? And we talk about these issues with, prior authorizations, claim denials, et cetera. there are definitely some companies that are worse with it than others. And just recently, we flew out to Vegas to go to a Medicare conference, and we actually met some smaller carriers, smaller Advantage plans, not your big name brand guys, but people who are in the Midwest or just in the South. And they let us know, yeah, we think that claim denial stuff is sick. That's awful. We created this Medicare company just so that we didn't provide the doctor any friction, as they call it. We didn't ask the doctor to jump through a bunch of hoops. If the doctor says you need it, we'll approve it. Whereas the bigger companies, it's all about the bottom line, right? If the doctor says you need it, well, we got to decide if you need it too, because our bottom line is coming into effect. Those board members and those, major people involved in these companies, they've got a fiduciary responsibility. How do we make sure we're making money? It's not that, oh, I feel so bad for poor Sally. It's Sally is client number 397, and this is how much we've spent on her this year. And can we afford to do that, or is there a way we can do something cheaper instead?
Yeah, it's crazy. To kind of piggyback off two of those points. The first thing is some of the articles that we've read are these large health companies have these algorithms that basically send a bunch of cases to a doctor, and it's like tens of thousands a day in some case, and the doctor is just sitting there denying, not even looking. It's just they have a software that says deny, 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 and it's like, it's insane. And I think another thing is you mentioned an HMO. The two most popular types of Medicare Advantage plans from what we see are HMOs and PPOs. And an HMO is a truly closed network unless it's an emergency and you're like out of state or something like that. And even that could be a pain to try to retroactively fix stuff. The other thing is a PPO. And I think there's a lot of disinformation about PPOs, like you said, because a lot of people say, oh, nationwide network, and they kind of assume a PPO is every doctor everywhere. A PPO is truly a flexibility. And it's the idea that you can leave the network hypothetically as long as both the insurance carrier and the doctor agree. And even if they do agree, the cost is probably going to be higher. The cost for going outside of the network could be considerably higher when all is said and done.
I love that point, because everybody always tells me, the clients come in and say, well, they have a PPO, they can go to any Medicare doctor. And I say, no, if the doctor accepts the terms and conditions, they can go there. They just can't go. And every week we face a scenario where, say I call a doctor's office and say, hey, will you take this company A PPO? And they say, absolutely not. Well, I thought if I could see any Medicare doctor, I could go anywhere with my PPO. No, it's still up to the doctor. In a normal healthcare plan, usually if you have a PPO, you go to the doctor, you pay your share, right? And the insurance company pays their share, and then the remainder can be balance billed to you. In most normal Medicare PPOs, they don't allow the doctor to balance bill you any remainder. They have to agree to your flat copay for out of network. So if the doctor, wants to bill $500 and the insurance company is only going to pay them $100, well, the only difference paid isn't the $400 the doctor was looking for, it's the $20 copay you have for an out-of-network specialist. Most doctors don't think that's enough. They say, I want $500. If the insurance company pays me $100, I want the other $400 from you. If you're in a Medicare PPO, they're not allowed to bill you the extra $400, so it can't happen. And a lot of people just deny and say, we don't take that plan.
Exactly. And I think it's interesting that you brought up, a minute ago about these localized Medicare Advantage plans that have less provider friction. And I think that's a good segue to one of our final points, which is provider friction is probably the number one thing you look for with any healthcare plan across the board. All the benefits and cool stuff in the world doesn't really make a difference if you can't see the doctors you want to see and get the care that you need at a price you can afford. But we've found actually, in our home state, we see there's more provider friction with Medicare Advantage plans as compared to original Medicare. But when you guys went out to Vegas, you found that certain states had more provider friction within original Medicare because there's so much Medicare fraud in certain states that the federal government is looking back and saying, hey, we can't touch this stuff because it's just not working out for us.
It was very seldomly does that happen, but that was a very unique situation in which, yes, some areas have so much Medicare fraud, somebody billing for 1 million electric wheelchairs that they never sold or bought and then getting all that money in, that Medicare itself is saying, whoa, we got to take a really close look at this and make sure this is necessary. I would say that's the 1 in 100 situation in which Medicare has a bit more friction when there's an area of a lot of fraud. But I definitely think it's important to notate that different areas, the Advantage plans have more or less, friction as well. New Jersey, as you mentioned, one of the reasons we have so much friction, I think, is that the doctors are so busy. Right? Doctors have hundreds of patients they're running through a day. If they're asked to jump through 10 hoops to get something simple approved, they're going to say, I don't have time to do that. I can't get this person back in here 10 more times for 10 more tests to get them the one thing that I know they need right now because I'm a doctor and I'm good at what I do. Amazing to think that they might send it off, as we faced with one company recently. Let's send it off not across the country, across the world to some other person in another office that says, oh, they're going to look at it and determine if that's necessary or not. So That I really, it's really rough to see that happen in some people's situation. But to summarize everything we've talked about today, we've got 5 things that most people don't know about Medicare. One is the cost. That cost over a lifetime can be huge depending on your situation. 2 is that Medicare doesn't cover long-term care like nursing home or home health care, and you have to plan for that ahead of time. Number 3 is that there is an out-of-pocket max coming for the drug plans, hopefully, as long as it doesn't stall in court or anything like that, okay? Number 4 is that we've got this pre-existing condition situation with Medicare supplements where if you're not new to Medicare, they may be able to ask you health questions. And number 5, Medicare Advantage plans can have a lot of prior authorizations or provider friction. So those, I think, are some of the most common things we face when we meet somebody turning 65, that we end up going into detail about all of those pieces. And those are the ones that people say, wow, I never knew that.
Yeah, it's awesome. And John, thank you so much for your time. If you guys don't know, John has close to 700 clients currently, so he's helped 700 people damn near across the country with this, and the agency NJ Life and Health we both work for has helped thousands of people. So this isn't just some random guy chilling. This is someone who knows exactly what he's talking about. So we'll have plenty more videos from him. If you guys want to work with us, feel free to reach us at www.njlifeandhealth.com. We work at about 20 different states that I'll post below, or you can call us or walk into our Toms River, New Jersey office at 848-226-6897. And also on our YouTube channel, we have tons of great content from John, me. We have a great podcast, as you're watching right now, Talking Retirement, talking about not just Medicare, but lots of other things. We talk to doctors and financial professionals about all the things you can expect as you age. So once again, thanks for tuning into Talking Retirement. And John, thank you so much for your time.
Thank you, Ken. And don't forget to like, subscribe, and keep listening.
Thanks again for tuning into Talking Retirement on YouTube. Please like and subscribe to keep up with the podcast, and check out all the other great educational content we have on the NJ Life and Health YouTube channel. If you'd like to listen to an audio version of the podcast, you can find us on Spotify, Apple Podcasts, and pretty much all other major podcasting platforms. For daily senior tips and to keep up with us at NJ Life and Health, follow us on all major social media platforms such as Instagram, Facebook, and TikTok at NJ Life and Health. And of course, if you'd like someone in your corner to help you with Medicare and life insurance, we would love to talk to you. Visit our website at www.njlifeandhealth.com or call our office in Toms River, New Jersey at 848-226-6897. We'd love to set you up with an appointment with one of our Medicare and life insurance brokers, and we are licensed in a lot of other states besides New Jersey. So no matter where you are, there's a chance we can help you out. Anyway, hope you enjoyed this podcast, and we will see you in the next episode.